Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County, with another round of Facebook Live events. I'm wearing my fashionable balaclava here, but since there are some people who read lips, let me take it down so you can see me. I'm adequately socially distanced here, so I should be good to go. Again, Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County, with another Facebook Live event. We're going to take your questions tonight, so if you have any questions, please put them in the chat section, and our lovely assistants here will get them ready for me and we'll get going. So as we usually do with this, we start off with what's happening with COVID, first in the world and then move down to Douglas County. Well, throughout the world, this is still a very active pandemic. In fact, in the last 4 days, we've had 4 of the highest daily counts we've ever had. So we're getting lots of new cases every day in the world. Fortunately, most of them are not in the United States, but they are in Brazil, Peru, India, and Russia. So really widespread out in the world here. And actually now there are more cases in the Western Hemisphere than in the rest of the world. So we're seeing a very active pandemic. What we're starting to see now is in countries that have less advanced systems, we're not exactly sure if we're really catching all those deaths and those cases. So we know in Brazil that their positive testing rate is over 50%, suggesting they're not testing very many people and not picking up some of the deaths. So it may even be worse than those terrible numbers we're seeing now. Also in Russia, there's a thought that there's some hiding of some of the cases and some of the deaths. So there may well be considerably more cases even than we see. We're starting to see more cases in Mexico, and this is a worry because there is a border with Mexico, and there are people who come across that border. So we are certainly worried about the increasing cases to our south. In the U.S., it's sort of a tale of two worlds here. New York and New Jersey that had a lot of cases before having fewer cases, but still a lot. California continues to have 1,000 or 2,000 cases every day. And then some other states are doing well, but then other states are starting to see big increases. Oregon has been nice and steady. You know, we've been having our 20 to 50 cases a day for the last couple of weeks, and we're still having that despite the fact that we're doing a lot more testing in Oregon. And so with the new cases that have come out have been generally lower severity, and our death rate has been low, so we've been having only at worst a few deaths a day. Well, in Douglas County is even better than that. We're sort of stuck at 27 cases here, 25 have recovered, so that there are only 2 active cases in the county. One of the recent cases that was picked up last week was somebody who was asymptomatic. So again, very few cases around, but we're continuing to do a lot of testing. We've now tested over 2% of the population, and despite that, we're seeing negative tests. The last 700 asymptomatic people we've done at Mercy and pre-op have all been negative. So I think what we're seeing is that there's a low rate of circulating disease in Douglas County. And that's a good thing because we asked last week to open up. We submitted our letter to the governor, and we should find out in the next couple of days whether we can open up to phase 2. Phase 2 would mean larger gathering sizes, would mean a little bit more, some more things being open. So I think that'll be a good thing to getting back to where we're at, especially with our low burden of disease. But I will tell you that there are other places in the country that I'm still really worried about. You know, these protests that we've had in other areas, there's certainly been no attention to social distancing in those protests, and I worry that we're going to see some secondary cases from that. In addition, there's been some really bad behavior in other places, in bars and other kinds of places where people who have been sick have been getting together, and we worry that we may see a real outbreak there. But Douglas County, I think we're doing well. We have a low burden of disease. I think people, for the most part, are following the rules, so I think things are going well. Okay, we'll start taking some questions. This was one of the things I was going to talk about. So this is an article that COVID may actually be a vascular disease. What do you think about this possibility? Well, you know, we have known now for a few weeks, and we've talked about the fact that COVID is associated with terrible clotting. And, you know, we'd said was, well, lots of bad diseases are associated with clotting, but this is really different and unusual. So what they did is they looked at a couple of cases, a bunch of cases of COVID, and then compared them to severe illnesses from other things. And clotting and vascular problems seem to be about 20 times more common in COVID than with other diseases. And it may well be that mild diseases of COVID are respiratory, but more severe diseases are vascular. And that would explain a couple of things. That would explain why we're seeing such a high rate of kidney disease, because the kidney disease seems to be clots to the kidneys, why we're seeing this high rate of strokes, and why we're seeing some of the encephalitis we're seeing. So it may well be vascular. This would also be a possible explanation why young people seem to be less affected than old people. So again, I love analogies. So when babies are born, their blood vessels are super smooth. Think of a nicely newly paved highway. But as we get older, we start getting cracks in the concrete, we start getting potholes, we start getting areas that are rough and whatever. And what that does is those areas that are rough and potholed draw inflammatory markers, and they can build up plaque or other kinds of things. And those really steeply rise with age. We almost never see vascular intimal problems in kids up until about 20. Then you start to see it at low rates, and then it really starts to increase in your 50s, 60s, and 70s, which is what we see about the severe disease that we get with COVID. So it may well be that mild disease is a respiratory disease, but the more severe disease is vascular, and we'll know this. So Amy says, is the virus weakening, as like they're saying in Italy? I looked at that paper today. This was one person in Italy said, boy, we're seeing much less disease now than we saw before. And the disease seems to be much less virulent than it was before, a suggestion that the disease may be mutating. Well, we do know that the disease is mutating a little bit, and that's how we can trace where it came from and when it got to this country. But we don't think it's changing enough to make it turning it into a non-worrisome virus. I mean, just look what's happening in Brazil, look what's happening in Peru to realize that this is still a dangerous virus. Viruses do mutate, and sometimes they mutate and get weaker. Sometimes they mutate and get stronger. But for the most part, the stronger viruses tend to win out over the weaker viruses. So I don't know what to make of this from Italy. After that guy published it, he got a lot of criticism for his methodology. So Patty says, when can we meet with the grandkids? So the good news is that kids don't seem to be big spreaders. When we look at these super spreader events, and that's what we've talked about in the past, where one person spreads it to many people, those super spreaders tend to be people in their young ages, people in their 20s, 30s, 40s, and 50s. They tend not to be the super old people, and they tend not to be the kids. And during this pandemic, we've had emergency child care open, no outbreaks at all associated with emergency child care. And in places that have opened schools, no outbreaks associated with schools. So we think that kids, although they may carry the disease, they may be much less spreading of the disease than other people. So can you meet with the grandkids? Well, it's a risk. And like everything we do, we talk about the risk tolerance. I'm a ninny, so I would never go ahead and skydive, even though it's a relatively safe thing to do. But there are other people who would. There are people who ride a motorcycle. Meeting with grandkids, certainly high risk than not meeting with the grandkids, but the benefit of meeting with your grandkids is awfully good. Now, if you're going to meet with the grandkids, what I'd have you do would be to, certainly if anybody in the group was sick, to avoid it. If everybody was well and you could do it, I think this is something you could do with a little bit of caution. So maybe the time to do it. Depends upon what your background is. So if you're a grandparent and you're 52 and healthy, probably lower risk than if you're 87 with multiple medical conditions. So again, you have to balance that risk. So there's been a lot of questions about the mortality. So the mortality from 10 to 20-year-olds is about 0.2%, 30 to 40-year-olds about 0.5%, 50 to 70-year-olds about 1.4%, and then 70 and above over 10%, and when you get over 90, over 15%. So Betsy says, when can we get together in a care facility? Again, this is going to be one of those risk tolerance things. The more people you get together, the higher it is. I think we're still going to be limiting visitors in care facilities for a while, but the final phase 2 guidelines are announced. I don't know about that. Well, one of the other questions was, explain again about this thing about comparing flu and COVID. And this is a little confusing, but let me get it. So when we say every year there's 20 or 40 or 60,000 people who die of the flu, there's only actually measured cases where people get the flu and then die in the hospital. That's only makes up a small fraction of that 60,000, maybe 10 or 15%. Whereas with COVID, we're only counting these deaths if people almost certainly had COVID. And so the flu is a statistical thing and the COVID is an actual count. If you did it in the same way where you counted COVID as a statistical count, the number of COVID deaths would be far higher. Or if you counted flu in the same way that you had to have a diagnosed case of flu, you had to be there, you had to die presumably of the flu, that flu would be 20 times less deadly than COVID. And that's about what we're seeing, so about a 20-fold difference in mortality from COVID over the flu. So yeah, COVID and flu are comparable, but COVID is so much more contagious, so much more deadly than the flu. The other question that we'd had was about when we're collecting nasopharyngeal swabs, whether you need to blow the nose. And the answer is if there's anything in the nose, you should blow it just to get the boogers out, because if there's too much boogers on the swab, it doesn't count. If there's not enough virus, it doesn't count either. So if anybody's got visible nasal debris, we would certainly have them blow their nose first. What is remarkable, though, is that people who have COVID don't complain of lots of nasal congestion as one of their symptoms. Now, they may have a runny nose, but there's little complaint of nasal congestion, like there is with so many other things where you get a cold and your nose just feels gross. Okay, one of the other questions came up is, could you explain a little bit about the Moderna vaccine? So the Moderna vaccine is an RNA vaccine. So what the RNA is, remember there's DNA, which is the book. There's RNA, which is the scratch pad, which tells what kind of protein to make, and then it makes the protein. In this virus, what we hope to do is to make a response to the protein. So what this RNA virus does is it takes some RNA, it encases in a lipid nanoparticle. It then injects it into your system. This lipid nanoparticle gets into some of your cells. The cells read from the scratch pad this protein and makes this spike protein. Your body recognizes then that the spike protein is a foreign invader, not something that's supposed to be there, and your body makes antibodies to it. So it's relatively complicated. There are no RNA viruses currently approved, so it's a totally new technology, but it would be a good technology because it would be relatively easy and simple to make. However, we don't know, since we don't have any RNA viruses out there, safety is going to be a big concern. And in some of the initial studies we saw, that as you got to higher doses, people had a lot of local reactions from this RNA vaccine with redness and soreness and muscle aches. So there could be an issue there. Again, it's only been studied in 45 young, healthy adults. They're now expanding it to study in 600 people with a wider age range, wider sex range, and a wider range of underlying conditions. So Janet asks, do we have any new cases? No. So we've not had any new cases over the weekend or today. Again, we're constantly looking. We've done over 2,500 tests, and again, no new cases. I think this just reflects the relatively low amount of disease here in Douglas County. Now, this is certainly not the case in other parts of the country. So when they look in Rhode Island, even now, the cases are running 5 or 10% positive. We're just looking for our next case. So Kathy says, do you think there'll be a rise in cases in Oregon as restrictions are lifted? There certainly could be. So I don't think we're looking that the cases are going to go away. So there could certainly be an increase depending upon what happens. So beautiful weather here. I was at the coast last weekend. This past weekend was rainy, but Memorial Day weekend, there were a lot of people at the coast riding four-wheelers, and they seem to be having a good time, but some of them got into wrecks, and they came into the hospital. So you can imagine during that time, as people were taking care of injured people. There could have been some exposure. Imagine these people were coming from somewhere else where the disease is more prevalent. They could then have brought it into Douglas County. And as we open things up and as we open up travel and we have such a beautiful place that people want to travel to, there is a chance that we will have cases. Our goal is not to have no cases, right? Because if our goal was to have no cases, we'd have to stay locked down like forever. If the goal, though, is to have a manageable amount of cases, which that is our goal, I think we can lift those restrictions. Now, still for people who are vulnerable, probably best to still stay home. But for people who are younger and healthier and have a little bit higher risk tolerance, I think getting out is okay. Okay, well, one of the other questions that came up was about what's new and different out there in terms of therapy. Well, I think as we go on, we get new data on things all the time. Chloroquine, there's less and less evidence that it works. For remdesivir, there was good evidence last week that it was not, as we said, not a home run, but maybe a bunt single. But then there was another result that came out today that suggested 5 days may help, but 10 days didn't. And that sort of scratches your head thinking why that would be the case, that a 10-day course wouldn't help, but a 5-day course would. So we're still looking and seeing. But again, nobody thinks that remdesivir is going to be the game changer. But there are a lot of us that are thinking that just like the first AIDS drug or the first drug for hepatitis C didn't work, what they did is they gave us a sense of what might work, and then you could move further and get it. And we may wind up with a group of antivirals that would work well against this drug, against this bug. And if we had that, that really could be a game changer. Listened to a conference today with one of the leading vaccine researchers. And the question is, are we going to get an effective therapeutic or a vaccine first? And this is a guy who does vaccines. He said, I think we're more likely to get an effective therapeutic, and we're more likely to get that. And he predicted it would be sometime next summer. So that's a good sign. It's a long time until next summer, though. And so I think we have to do these other kind of public health things that we do to keep this down to a dull roar. One of the other questions that came up this last week was about, I'm so confused about masks, they say, and my answer is, I'm so confused about masks. So you remember we went for a time that don't use masks, and then the US said wear masks, and then the WHO said don't wear masks, and then they came out this week and said, well, probably don't wear masks. The point is that masks really do decrease spread from me to others, probably 50% or more. And since we're recognizing that these super spreader events are out there, if I happen to be a super spreader today, by me wearing a mask, instead of me spreading it to 20 or 50 people, I may only spread it to a few. And writ large, over time, this could really decrease these big outbreaks. So it is confusing. The other one that came up is, does eye protection help? And there was a recent study that suggested that eye protection, even in the form of eyeglasses, does help, which is, again, not surprising. I mean, at the end of the day, I take my glasses off and I polish them, and you see all the little spittle drops on there. So you realize that during the day, there are people, when they talk to you, that do put spray in your face, and the glasses do seem to help. So Evelyn says in the last two cases, were they from travel outside the county or what? Well, one was asymptomatic, so you don't know where in the world it came from or when they had it. So what happens, we know that this RNA can stick in your nose for a long time after you've had the disease. So we don't know when this person was sick. So it would have been impossible to know when they got it. They did not have any travel, any out-of-state travel during the entire pandemic. So it probably wasn't that, although they were outside of Douglas County. The other case, we don't know. So Amy says, is it common for your blood pressure to increase when you're wearing a mask? So no, not from the mask itself. So the mask itself, especially if you use a cloth mask, does relatively low levels of filtering inward. So it really doesn't change blood pressure or oxygen levels or anything. There are some people who are very sensitive, they have COPD or something, in which case they probably shouldn't wear a mask. And other people's blood pressure may increase while wearing a mask because they're nervous about wearing the mask. So I'm not particularly claustrophobic, but if you were claustrophobic, I can imagine wearing a mask would be absolute torture. And so I can imagine if you're claustrophobic and got really anxious when you were masked, your blood pressure would go up. But it's not specifically from the mask, it's from the underlying feeling of not wanting to be suffocated. Okay, a couple of more things here. So one of the questions about the different kinds of tests. So the first kind of test is what we call a nucleic acid test. And that's the kind of test that looks for the RNA that's in this virus. These are the PCR tests. And these PCR tests can be either done in labs, like the Oregon State Public Health Lab or Quest, or they can be done by these rapid machines like the Abbott test. Those tests can be sampled in different ways depending upon which platform you're using. The platform we're using from Quest requires a deep nasopharyngeal swab. We think this is the test that has the best sensitivity and the best specificity. This is very similar to the CDC test that recommends the use of nasopharyngeal swab. However, there are new tests out there that can use nasal swabs or oropharyngeal swabs. Having done a bunch this weekend, I can tell you an oral swab or a nasal or an anterior nasal swab is much easier than a nasopharyngeal swab. And it's this little balance of a little bit of decreased sensitivity versus ease of doing. And I think they're all logical ways to do it. We, for example, are going to do some screening next week, and we're going to use a test that uses an anterior nasal approach. The question of the difference on sensitivities of this is going to be answered in the next few weeks. U of O is going to do a study on incoming students and athletes where they're going to swab from multiple different places, use the same methodology, and find out what the difference in sensitivity is between the sites. So Brian says, what are the newest studies showing the percentage of asymptomatic cases in the U.S.? So the best studies on looking for asymptomatic spread are looking in places where you really did test everyone. And so there's a new study out from a ship that was going to go down to the Antarctica for a trip. And what they found down there was that a good portion, at least 50, but maybe 80% of the people who had the disease were asymptomatic. So that's a very high asymptomatic rate. On the Diamond Princess, it was about 40% asymptomatic. On the Ruby Princess, it was similarly about 40% that were asymptomatic. On the aircraft carrier Teddy Roosevelt, it was over 40% that was asymptomatic. So there are a lot of asymptomatic cases here, somewhere between 40 and 80%. So there are a lot of asymptomatic cases. Now, some of those asymptomatic cases are asymptomatic at the time you test them, and then they become symptomatic so that they're not really asymptomatic, they're really pre-symptomatic. And when we look at the big spreader events, it's almost always the pre-symptomatic people who have this. Now, the problem is these pre-symptomatic people are only pre-symptomatic for a day or two, so you have to get them exactly the right time. So unless you're screening people every day, you may miss these pre-symptomatic people. But there are presumably lots of asymptomatic cases. And so what you think on this may be that in the mildly symptomatic or asymptomatic people, they have a little bit of it in their lungs, their body takes care of it pretty well, makes pretty good immunity, and they're done with it. So that would be the good sign. Presumably these people do not get a lot of vascular disease. Presumably they don't get a lot of other symptoms because we've not seen people with kind of stealth disease. Either you're symptomatic typically or you're not. So, the rate of asymptomatic carriage in the U.S. is important. Now, the problem with this is does an asymptomatic case give you good immunity? And we don't know the answer yet. So we still don't know whether having antibodies to this means that you can't get it again. Actually, in this last week, I've probably read 5 different articles by people, and some give convincing information that this should protect. Some say it won't protect. I think the consensus that I look at looking at these is this may give you some protection for 6 to 9 months. That wouldn't be great, right? Because that would mean you could have had the disease in March, and then you could get the disease again in December. That would really stink. And it would be terrible for the society, because then you wouldn't know who. You'd never really get past this. Now, there's some people who think that the next time you get it, it may not be as severe. And so if you got it really severe the first time and then a mild case the second time, that may be okay. But this is a weird disease, and having so many people who are asymptomatic, and then those few people who can spread it to so many people. What's that about? I mean, that's unlike any other disease we deal with. The only other disease that had asymptomatic cases and the super spreader phenomena was SARS-CoV-1, which was the virus that caused SARS. Well, it's a beautiful day after a beautiful weekend, and it looks like the questions are dying down, which is a good thing. So I'll give you another minute. I have 2 more things that people wanted to talk about, and I'll go through those, and then if we don't get more questions, we'll call it a night. So one of the questions is, what is phase 2 going to look like? So phase 2, I saw an advanced presentation on that today. Looks a lot like phase 1. Bars might have an extended opening time. Pools might be opening. They actually have new guidance for axe throwing. I didn't realize that needed guidance, but new guidance for things, new guidance for bars. And whoever has been asking about the pool tables, I'm hoping that the pool tables are in there. But we may see that. We might see a little bit more. We might see larger gatherings, especially outdoors. I think they're going to allow up to 100 people in an outdoor gathering, and will likely better define what an outdoor gathering is. I think we're going to start to see some changes in outdoor recreation. We're set to get some guidance about sports teams restarting practice. And I think we're going to get to see some early guidance on what we're going to do for schools, because as you know, there are some summer schools, and the schools would have guidance about what happens. So I expect to see all of these in the next few days, actually, and so that hopefully we'll be ready for reopening on this Thursday or Friday. That would be a good thing. However, I want to caution people that this doesn't mean we're past it. This means we're past that first stage of it. And what we really need to do is to continue to do the social distancing, staying home when you're sick, wash your hands if you want to wear a mask, and so please do all those things. Okay, well, that was the last of the questions. It's a quick night tonight. It's a beautiful night, so I'm hoping people are not watching me and are out taking a walk or enjoying it with their family. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County. Thank you.